Hello, this is Trish Grooms, and I work at Texas School for the Deaf as a counselor. I've been here for 18, almost 19 years now. Prior to getting started with our webinar, I do want to let you know that we have references as well as resources available in the website for you perusal later on. Moving forward, I'd like to talk about trauma and adverse childhood experiences and their impact on mental health, especially with deaf and hard of hearing children. In order for me to do this, I need to share with you about trauma and adverse childhood experiences and what those mean, and how it is often used as a gauge in working with children who have trauma. However, be mindful that there will often be times in which you will not know if any of your students or children in which you work with have any sort of trauma or adverse childhood experience. There are two types of trauma. It is important to understand the differences and what some of the signs are of those. The first is betrayal trauma. That is a personal experience of interpersonal violence and happens when caregivers betray their trust. And that could be a family member, a teacher, a pastor or priest, a therapist, or other caregiver. Whenever that caregiver betrays their trust, that they will keep them safe physically, psychologically, and emotionally. Some examples include sexual abuse, neglect, physical abuse, emotional abuse, or witnessing others that they care about in violent situations. The earlier that the abuse occurs, the more damaging it can be. Even years later, into late childhood or adulthood. Unfortunately, even after 80 years, when Dr. William A. Bryan recognized and wrote about the effects of psychological abuse being more devastating than physical abuse, things have not changed much. Betrayal trauma continues to be a significant concern. The second type is acute episodic trauma. That's when an event occurs. It can have a devastating effect on people and potentially threaten their lives. These events are also in which people have little to no control over. This is a typical result of natural disasters, but not always. It could be a car accident, it could be a home fire, it could even be a random act of violence. Not all people will develop traumatic responses. It depends on different factors that people have that may help them make it easier to get through that event. Such have a good support system, how severe the event is, whether or not there were any serious injuries or death. And that can really impact how they get through that trauma. Now, what is adverse childhood experiences? Abbreviated ACE. Back in the year 2000, the Center for Disease Control, or CDC, and Kaiser Permanente Insurance, or KPI, jointly published an article with research on adverse childhood experiences. This research was conducted for almost 17,000 people covered by KPI. They were asked if they'd be willing to fill out a survey as to whether or not they experienced 4 or more childhood experiences that were adverse. Those include recurrent physical abuse, recurrent emotional abuse, sexual abuse, living with someone who was an alcohol or drug abuser, living with a family member who was currently or has been incarcerated, living with someone who is chronically depressed, suicidal, or who has been institutionalized or had a diagnosis of mental illness, experiencing emotional or physical neglect, or living with one or no biological parents. Of those 17,000 within the research, only 33% reported an absence of ACEs. So let's think about this for a second. The people who were asked to be a part of that research had insurance. So most likely, this was a group of people who are probably middle or upper class Americans. And only 33% reported no ACEs. So if you were to figure out the math on the general population of all the economic classes, about 2/3 of the population in the U.S. have grown up in an environment with one or more adverse childhood experience. And again, this was in the year 2000. If we look at the United States today, those numbers are probably much higher. The results of the research showed that the lowest percentage of people reporting trauma identified emotional abuse, about 10%, sexual abuse, 21%, and physical abuse, 26%. People are not typically forthcoming when talking about abuse due to its secretive nature or the emotional aspect involved. The results of the data on reports of abuse and neglect is astonishing. The data in specialized services is even more confounding. 55% of students in specialized educational settings report that they were exposed to ACEs. Studies show that 92% of patients in psychiatric hospitals had a history of sexual abuse. 51% of them were female. Research shows that those with an ACE score of 4 or more are 12 times more likely to attempt suicide, 7 times more likely to become alcoholics, and 10 times more likely to have injected street drugs. All of that being said, now let's move on to the classroom and what that looks like there. Usually, schools are the first organizations that face the effects of adverse childhood experiences. Children that experience those are usually first seen in the school system. There was a study done in Washington State in 2009-2010. There were 30 students within a classroom. Only 6 were reported to have no adverse childhood experiences. So out of 30, only 6 had no reports, which means 24 had at least one or more ACE, which is significant. Of the remaining 24, 5 had 1 ACE and 6 had 2. 3 students had 3 ACEs, and then there were 7 students that had 4 or 5 ACEs. The remaining 3 had 6 or greater. So those numbers basically indicate the high need for trauma-informed classes. I hope this gives you an idea of how serious this is, as well as how often this can be overlooked when teachers and staff are so busy trying to meet the demands of time-oriented activities required in order to meet the standards set by the state. For example, state testing and things like that. So now, if you can take that information from that classroom and apply it to deaf and hard of hearing children in special education, we can assume that the percentage is much greater. What kind of vision does that give you? And if you add language deprivation to the mix, language deprivation, there is not a lot of research, but research is increasing. Considering that is a form of neglect, Imagine the impact. Neglect itself is an adverse childhood experience, which means probably all of our students have at least one adverse childhood experience in one way or another. So what are the lifelong effects of adverse childhood experiences? What do you think the effects would be in the long run? Data from the ACE study shows that people with 6 or more ACEs have a lifespan that was on average 20 years shorter. The effects on general health is important to consider in addition to the effects of trauma on mental health. For example, this can include behavioral challenges, and the more behavioral challenges there are, the more socially isolated someone becomes. The more socially isolated someone becomes, the more their health will deteriorate. And this can also impact their mental health, whether that be paranoia, agitation, a lack of trust in others, which further compounds their general health. It could be related to nutrition or obesity, poor appetite, use of drugs. And then also consider language deprivation, which further impacts isolation, poor quality of life, poverty, etc. The bottom line being that the quality of life decreases. Now, understanding the effects of trauma in ACEs. The ACE pyramid was developed by Dr. Rob Anda with the CDC and is used to demonstrate the ways in which adverse childhood experiences affect health and well-being through the lifespan of a person. And by the way, this pyramid is available on the website for your reference. In looking at the pyramid, at the bottom, you would have the ACE, or the number of ACEs. And then they think about when that impact would begin, starting from the time of conception into adulthood. The baby in the womb can actually experience trauma, which is why it's at the bottom of the pyramid. If a pregnant mother is in a domestic violence situation and is constantly stressed and in fear for her life, the baby in the womb can be impacted. The next part in the pyramid is what's called disrupted neurodevelopment. The parts of the brain are wired together, and between the ages of 2 to 6, that's the time in which is responsible for motor regulation, emotional reactivity, sexual behavior, and the ability to form relationships with others. I'll go into more about disrupted neurodevelopment later on in this series. The next part is related to adoption of health risk behaviors. Typically, you see that more with teenagers and young adults. And those can be risky behaviors such as use of drugs, becoming an alcoholic, and other types of risky behaviors. It can also be a lack of taking care of oneself, not worried about their health, unhygienic. Above that is disease, disability, and social problems. The more those health and risky behaviors come up, the more they're likely to become sick, have some type of disability. It could be the loss of a limb or other health issues. And ultimately, social problems, which can lead to isolation and no interaction with others. This can lead to further anger within that isolation. At the very top of the pyramid is early death. And so moving up that pyramid can lead to the early death. Where they fall on that will depend on the kind of support system they have. The less they have, the worse off they'll be. And so there's something I always ask. Who is the hero in their life? If they have someone that is a hero to them, then they can heal from there. Now, let's talk about the neurological system for a minute. As you already know, the brain, along with the human neurosensory system, is very complex. So think of your brain as a road map with different types of roads, such as highways, roads, streets, and alleys. So a person with trauma, that experience not only will wound the person, but it will also disrupt, change, and redirect the ways in which the neurological and sensory systems develop. So think about construction barriers, delays, traffic backs up, detours, and other disruptions you may experience when you're in the car on the highway or roads. In a like manner, trauma can interfere with the sensory input, the process of external senses, emotional state, and behavior output. So if a disruption occurs on a highway, the same thing occurs in the brain with trauma. If a person feels safe and secure, the roadmap within their brain and body will work smoothly. Whereas if they're not feeling safe and secure, such as if they're experiencing neglect and abuse, their roads become bumpy, may even have dead ends within them. Or perhaps they go in circles and never seem to get to where they want to go. Trauma disrupts the neurological system people need to use to keep themselves and others safe. With that in mind, think about how these disruptions might impact behavior, or even mental health for that matter. If a person experiences tremendous betrayal trauma from an early age, then the wiring within the brain has already been set to where the response would be different than the typical, such as being able to trust, have positive and appropriate relationships, accepting various sensory inputs. So it will change their brain into a manner of different responses. So that being said, think a little bit about yourself whenever you become frustrated. Perhaps when you're communicating with someone. Let's say maybe you're going to an auditorium and you can't hear the speaker, or perhaps maybe you can't see the speaker, or anything like that that causes frustration with communication. Or perhaps someone from a foreign country may be using another language. So think about that for a second. Consider that frustration that you experience throughout that. And your response is normal. You're trying to determine what and how to solve that. However, some people respond with exasperation and they simply can't figure it out, or they can't get past it. Consider how that is different from people who experience trauma or adverse childhood experiences. If a person has trauma or ACEs such as neglect, that can intensify their response with greater frustration, perhaps temper tantrums, further disruption. The same thing happens with language deprivation. Their response may be more severe. So if a person with acute episodic trauma experiences something like that, it will have disruption that creates construction, so to speak, or develop a detour or new road within the brain in dealing with intense emotions or not feeling safe. So, for example, let's say a tornado occurs and there's quite a bit of devastation. That person may have moments or temporary detour when big storms come in, and eventually they'll start to feel safe again. And once those feelings of safety come into play, then that road can become smooth again and lead back to that main highway, so to speak. The brain's wirings can be disrupted with trauma. The longer people with trauma go without any positive connections, interventions, and or support, the wiring within the brain can become permanent. So the power of relationships can really have an impact on the effects of trauma. We already know that betrayal trauma can severely impact how relationships are developed. In order for those to confront their trauma, their caregivers, teachers, medical professionals, therapists, and others need to do more than just look at them. They really need to see who they could have been had they not been exposed to trauma and ACEs. To see who they could have been, that's where the hope begins, creating a place in which they feel safe and see them for what they could have been. And that allows for that healing process to begin. The good news is, in addition to that hope and healing process, the brain can and will adapt. It's amazing. The brain can and will adapt to new environments. When children, especially young children, are placed in environments that are predictably safe and secure, their brains can rewire. The brain is incredibly adaptable. Children who are between the ages of 6 to 8 years old can more easily rewire their brains than children or adults. Older children and adults can rewire their brains. However, it just takes longer, and there are greater needs for long-term consistency and predictability within their environments. There is plenty of research that supports this. One is Dr. David Willis, a neurologist in Portland, Oregon, who conducted research back in 2009 in which he was following roughly 1,000 children who had been removed from their home by Child Protective Services. Dr. Willis found during the course of his study that whenever the children were placed in a safe place, most of them were able to get back on track for typical neurological development. So, before I discuss the different states of the brain, I want to backtrack a little bit to talk a little bit about my experience with a person who was basically language deprived. I was young back then. He was 50, I believe. I was probably 24, 25 at that time. He came to our program. At that point, I was working as an independent living instructor. He was in his 50s and had recently lost his parents and had no language whatsoever. However, he could gesture. He could mime really well. He was able to show his meaning through that gesturing and role-playing. So he came to our program with no language. His parents were out of the picture. He really had no skills in general. He was the type of child who his parents had sheltered him and kind of hidden him away from the world. So when he got to us, it was very serious. We started very basic. We went to different places, such as the store, basically starting with labeling. Similar to what we do with 2 and 3-year-olds, we begin with labeling. That's where we started. We also taught him skills. Looking back on that, the amount of language deprivation he experienced and where he was at the time, I think that pretty much the only thing he truly experienced was language deprivation. However, that had a massive impact on his entire life. At age 50, when he came to our program, he was able to eventually get a part-time job with a lot of coaching and became independent, but still needed a lot of support. I would say he passed away around age 55, 56. He had become diabetic, had several health issues that popped up about 2 years after joining our program. So the more I think about that gentleman and how he was able to overcome several things, that kind of puts it in perspective. But again, that was only a single ACE that had a lifelong impact upon him. So when we look at individuals who maybe have a parent that's incarcerated or they've lost a loved one, they are able to go through it. Neglect can have lifelong implications. It can lead to hoarding of food. That's a common behavior we see with that. But with this gentleman and experiencing language deprivation, that is a very severe form of neglect. So I look back on that experience and it's just something for you to think about when you work with individuals who are language deprived. Today, we're now talking about, 30 years after that experience. We still have children who are coming into school with no language. Parents become hopeful that language can be fixed, but beyond the age of 7, 8, 9, the opportunity to do that, it's almost too late. It requires a lot of work for them to make progress. So be thinking about that. So now I do want to talk with you about the different states of the brain. Knowing this information will not only help you identify the child's state of mind, but it will also help you identify your own state of mind as well. The different states of the brain have a real impact on how people respond in general. Those with trauma can have a much stronger or more extreme response. Dr. Becky A. Bailey developed a brain state model that recognized 3 basic brain, body, and mind states. She states that the purpose of learning these states is to help identify the internal state that a child is most likely experiencing and then assist that child in achieving an optimal state for learning new skills before attempting to address the behavior. So these 3 states include survival state, emotional state, and executive state. Survival state is a response to threat. It's self-defense. That's really the primary goal and intention. It results in some of our most primitive behaviors, which include fight, flight, or freeze. This is also the oldest and most primitive part of the brain. Dr. Bruce Perry, another well-known child psychiatrist, has authored numerous books and articles on the brain, how the brain works within a trauma, and the states of the brain itself. I found them very fascinating. So I will use some of his hand-shaped model for the brain. So this fist here, this symbolizes the brain. This is a brain that is functioning typically. However, when you have survival state, you see this hand shape here, quote unquote, flip it the lid. That is when someone feels unsafe. That means that your alarm bells start ringing within your body, and your body quickly reacts. So obviously, it flips its lid. The brain looks like this and quickly responds. These skills are accessed unconsciously, non-verbally, and automatically. Self-defense at all costs. So think about a child who is physically aggressive. They may be throwing things, kicking their feet on the floor, having a tantrum. Perhaps they're withdrawn, or they even run away or hide, shut down, or perhaps they're even in their own world. Think about those kids that have those behaviors. For these children, they are demonstrating that survival state. They need to feel emotionally, socially, and physically safe. And until those feelings of safety have been achieved in those three areas, their behaviors will continue. So this sense of safety provides a strong foundation in development. Now, the emotional state. So this hand shape is survival. This hand shape is the emotional state. This is where we become triggered or upset within an emotional state. And that happens whenever things are perhaps not going our way. It's kind of similar to having all your buttons pushed. People will push our buttons, try to rile you up. And so that's the same concept. How many of you, perhaps when you were young, said something like, "I will never be like my mom," or "I will not be like my dad," or "I would never do that"? Things that are easy to say when you're young. However, now as an adult, are you doing similar behaviors to what you said you would never do? That's the funny part. And emotional states can be carried on, can be passed on. It's the same concept of when you're driving and then all of a sudden someone cuts you off and you feel like you just escaped being in an accident. And once that feelings of danger subside, typically what do? You tend to start yelling, "What were they thinking? They almost killed me. You're such an idiot." Things like that are easy to say in the car, right? Now let's suppose you have children sitting in the back seat, watching the whole thing transpire. It means that you're teaching the children in the back seat that it's okay to call people names, to yell, pass harsh judgment whenever the world doesn't go your way. So that lesson that you just taught the children gets carried on to, say, the grocery store. Perhaps you're in line ready to check out. The kids are standing there and they mention, "Hey, I want candy." And then you tell them no. Don't be surprised if they do the very similar thing that you did in the car. They'll say, "I hate you, Mom. I can't believe you ignored me." And they may argue with Mom. And this is what we call our personal recording that gets filed away in our memories. It's those personal experiences that stick with us. Oftentimes, these recordings and memories can actually be false messages. Like, "I'm not good enough. I'm worthless. Something's wrong with me. Children are brats. Oh my gosh. Children are mean." Those are the type of messages that can be learned over the years. And those false messages are typically about perception. And those are things that we've learned from an early age. Oftentimes, those perceptions can be carried on over the generations. So now think about children who've experienced trauma in addition to being on the receiving end of the emotional state of others. That's where the developmental question of, am I loved? That's when that really crops up in those kids. That's why positive relationships and attachments are so important for brain development. Being excluded or unloved is a huge emotional trigger. And that's a universal fear as well. So when you think about working with these children, it is critical for you to be cognizant of your own emotional state, and then try to move to the executive state to be able to choose your behaviors when working with those children. The executive state, the third state in this model, shows this right here with this hand shape. It means everything's integrated, it's ideal for learning, it's a relaxed alertedness. Within this state, we can navigate our thoughts and feelings rather than being driven by emotion. Within this state, it also helps us look for solutions rather than casting blame, instead of fixating on something as well. This is where we learn to make choices that will drive our behavior. We capture our true potential whenever we are in this particular state. It's also within this state that as an adult, in general, we have different executive skills. However, when dealing with discipline issues with children, we oftentimes expect them to have the same skill set that we as adults have. However, children do not yet have those developed. So it's important to be aware of what skills the children have and do not have. Children with trauma are more likely to not have many skills in this area, and they need to be empowered to do it for themselves. If a child feels safe and loved, it will create a willingness for them to learn to change and adapt existing behaviors. It can be difficult for children or anyone with trauma, and they are oftentimes unwilling to let go of some of those primitive behaviors, impulses, and strategies that interfere with their abilities because self-preservation is their goal at this point. Now, knowing all of this information that I've shared with you so far today, what can you do to become a trauma-informed classroom or environment? It's important to consider how. First and foremost, you should take universal precautions in trauma. And really what that means is treat every person in your classroom or environment as if they have already been exposed to one or more adverse childhood experiences. Another thing you can do is consider your environment, whether that be a classroom, office, or other area in which you are. Does it look inviting and welcoming? Does it feel safe? Is it cluttered or disorganized? Do you have a safe spot in the room where calming techniques are posted, along with calming items there in that area? Another thing you can do is even having a bowl of fruit or granola bars that are accessible at any time throughout the day. Look for things that can help the room feel safe. And that includes physically safe, emotionally safe, and socially safe. That creates a culture of wellness within the environment. Empathy, compassion, achievement, respect, and engagement. Those are all an important part of that environment. Now, looking at top-down versus bottom-up approaches. Behavioral approaches to working with people who have behavioral challenges are called top-down interventions. Some examples of those top-down interventions or approaches include positive behavior intervention supports, or PBIS, cognitive behavioral therapy, behavior intervention plans. Those are all interventions that use thinking part of the brain. Whereas bottom-down approaches seek to provide safety to the person through the body. Some things that include repetitive motion like rocking, swaying, gum chewing, even drumming. Those can create a sense of safety within the body at the neurological level. So, for maximum effectiveness, bottom-up regulation should be used first, and when the person stabilizes, then you can begin to use top-down interventions, which will become more effective. Now, looking at restorative discipline. Rather than a punitive approach within the classroom, restorative discipline is more proactive, supportive, and responsive. It aims to create a culture in which issues are lessened and less likely to pop up. And when they do, people have connections and the skills needed to handle them and restore the community as needed. This approach fosters belonging, social engagement, and meaningful accountability. Last but not least, individual accommodations. Think about the bottom-up approaches and consider adding those to the child's accommodation list. Also, be fluid and flexible with the accommodations. If at all possible, do not put time restraints on the child. Allow the child to be engaging as much as possible. And what that means is allowing the child to be in charge of their process of recovery. Person-centered planning or individual education planning process is another example of allowing the child to develop skills at their pace. So in closing, thank you for your interest in creating a trauma-informed approach to help the people you work with. By doing this, you decrease the disruptions to their brain and help them rewire their brain to develop healthy coping strategies, healthy and positive connections with others, and healthy wellness with their bodies and mental health. You, I'm looking at you, can become a hero for someone with serious trauma that they may increase the quality of their life in the long run.